Hey guys, Dr. Saccone with MedCore Asthma and Pulmonary here with your May 28th COVID update. There's been a lot of positive things we're seeing with respect to the direction that we're heading. Not surprisingly, there's good and bad topics to discuss. But we're getting through this, and the light at the end of the tunnel is brighter each day. I'll bring up topics we've touched on before, but with the most up-to-date information, such as masks, transmission routes, and mortality rates. We'll talk about what we're seeing in the states that have been opening up, as well as the states that are still tight on their restrictions. Again, don't let anyone try to convince you that this conversation is anything less than extremely complicated. We're going to stick to the medical and epidemiologic facts and try to cut through the politics to give you unbiased information so you can make your own decisions. Because as this all progresses, we'll be making our own individual risk assessments and living our lives as safely as we can. So, first things first, where are we on the curves? The U.S. data, both in cases and daily deaths, is continuing in the right direction, and we've not seen any significant uptick in the cases or deaths. And this is great news because many states have begun relaxing restrictions and have been doing so for a few weeks. So if there had been a lag in identifying the cases, it should have caught up by now. This tells us that the masks, social distancing, and easing of restrictions is in fact working. In New Jersey, we again show a continued significant drop in cases as well as deaths. This is also very important because of Memorial Day weekend just passing by, the shore was open, there was a lot of traveling, and also restrictions on both indoor and outdoor gatherings were relaxed. So starting as early as Monday, we would have expected to see the beginning of a spike in cases and hospitalizations, etc., and we're not seeing this. And this is fantastic news because it means that people are doing the right things and, generally speaking, are being responsible. Pennsylvania again is seeing a very similar trend and is opening up in a different fashion than New Jersey. So these reopenings, which are being done in many different ways, do not seem to be causing the spikes that we had feared. Kentucky as well is over their peak and is about 2 weeks into the downslope and is starting to relax as well. And I don't expect to see a significant spike anytime soon in this area as well. So why haven't we seen the uptick in cases across the country as restrictions are relaxed? Well, there's no clear singular answer. There is the possibility that what we've been allowed to do really wasn't a high risk of transmission to begin with, so allowing us outside, on the beaches, etc. won't cause a spike. There's also credibility to the current weather, with high levels of UV light and higher temperatures, which have been routinely shown to decrease the spread of coronavirus as well. Now, while these are likely contributors, the larger factor is the use of masks, continued social distancing, and appropriate hand and face hygiene. The use of masks has been a polarizing topic, and honestly, it doesn't need to be. Think of masks like this. They catch droplets that you breathe, cough, sneeze, etc. The general cloth mask or surgical mask will provide variable protection for you, but will decrease the risk of you passing the virus to a more vulnerable person. And this has always been the point of wearing masks in the general public. You don't need to feel sick to wear the mask because about 40% of the infections right now are asymptomatic. So you may not know you have it or that you're spreading it. Now, you don't need to wear a mask when you're by yourself unless you're in a situation where you could spread the virus to a susceptible person. Say you're fixing something at your elderly neighbor's home when she's not there. Yes, you're alone, but the mask is still a good idea. You don't need to wear the mask when you're in your home, in your car, or even outside if you're able to socially distance. In other words, if you're having a picnic with your kids in a park and there's no one around for 100 feet, there's no medical reason that a mask would be necessary. But local ordinances may demand it, depending on your locality, so please follow appropriately. But if you're outside and on the boardwalk and not able to stay 6 feet apart, yes, you will need a mask. And for the love of God, if you go swimming, do not wear a mask. The mask will get wet and this can suffocate you. This is basically waterboarding and you can die. Now, what is the latest on how it's transmitted? The data is showing that the transmission is almost exclusively person to person, in contrast to person to object to person. So respiratory droplets from coughing or sneezing, which would get caught by the mask, or viral particles that are on your hands, your face, or your clothes, get in direct contact with other person's face, etc., and they get infected. Now, this is not to say that it can't be spread on an object, but the number of cases where someone was infected from groceries or a package, etc., is exceedingly low. What about the mortality rate of those who get infected? The latest data is very optimistic for the younger populations. In the US, it is showing that the fatality rate for those under the age of 50 who get infected is 0.05%. This rate is less than the seasonal flu, which is around 0.1%. Now, there are a fair amount of deaths in the less than 50 age group because of the widespread nature of this virus. But this should give some solace to those in this age group who are going to be going back to work or daily life soon. However, this is not me telling you to throw caution to the wind. And the fatality rate does go up as we go into the older age groups, which is why we're doing everything we can to protect them. Now, this data is partially skewed because of the large number of deaths that we've been seeing in our nursing homes, and it may not reflect the fatality rate of those healthier individuals in their cohorts, but we are seeing a 1% fatality rate of those infected in their 50s, 3% of those in their 60s, 8% of those in their 70s, and a 15% in the 80-plus cohort. Again, even the 15% means that 85% do survive this infection, but it's still a very sobering statistic. How are things in the states that have opened up versus some that have remained locked down? So here's good news. In states that have done very calculated reopenings, states like Florida, we are seeing continued decreases in all metrics, in cases, deaths, hospitalizations, etc. It's even lower than many states with strict lockdowns still in place. And this is very good news. It's showing the virus does not spread easily outside and that people are being responsible. We're seeing similar downtrends in the states that are continuing to lock down, but there are some scary statistics here. We're seeing suicide rates, opiate and substance abuse deaths skyrocket. Most places are reporting a 1,000% increase in suicide hotline calls. California has reported more suicides in the last 4 weeks than they generally see in an entire year. And some places are actually reporting more deaths from suicide than from COVID. So please, continue to check in on your family and your friends, and remember, many people who are looking to get back to work aren't doing so because of the economy. They're doing so for their own mental health and well-being. Please, be kind on social media and don't immediately jump to shaming a person who's wishing to go back to work. Like I've said, this conversation is extremely complex. There are many important topics and arguments on all sides. It's seeming the gradual reopenings have been done so safely, and many of our neighbors are showing an exemplary ability to do the right thing. Yeah, there are the idiots that are throwing parties in parking lots, but the vast majority of Americans are being cautious and responsible. The curve is still flat. In fact, it's decreasing. We are getting through this. Keep it up, my friends. There's a bright light at the end of this tunnel. Take care, and God bless.